Hi, Blood Talk fans. Welcome to today's Hematology Reviews questions. In this video, we are diving in depth into some critical blood disorders and diagnostic tests that every healthcare professional should be familiar with. We will go over key questions related to hematology tests, red blood cell aplasia, serum ferritin, and iron stores, and break down the answer with detailed explanations. By the end, you will have a clear understanding of these topics and their clinical significations. Let's get started. Which disorder is screened using the acid serum lysis test? The answer is B. The HEM test, also known as the acid-filled serum test, is a laboratory test using the diagnose conditions related to red blood cell destructions, particularly in cases of PNH. How does it work? The test helps determine if red blood cells are suspected to being destroyed in an acid environment. A sample of patient blood is mixed with serums that have been acidified. If the red blood cells are destroyed or lysis in the acid condition, it's indicated as possible diagnosis of PNH. A positive result suggests that the red cells are vulnerable to hemolysis, which is a hallmark of PNH. Overall, the HEM test is a useful tool for identifying specific blood disorders related to red blood cells health. Clinical significance. The HEM test is less commonly used today due to availability of more specific and more sensitive tests such as flow cytometry for PHN. However, it can still useful in certain clinical contents to evaluate complicated hemolytic conditions. Overall, the HEM test provide insight into hemolytic mechanism affecting red blood cells, aiding in the diagnosis of related disorder. Next, let's talk about PNH. What is PNH? PNH is a red blood disorder categorized by the destructions of red blood cells. It occurs due to mutations in a gene that affect the surface protein of red blood cells, making them vulnerable to destructions by the immune systems. Key features of PNH include hemolysis. Red blood cells break down prematurely, leading to symptoms such as fatigue, dark urine, especially in the morning, and anemia. Blood clot. Individuals with PNH are at an increased risk of developing blood clot, which can lead to serious complications. Bone marrow dysfunctions. PNH can be associated with other bone marrow disorder affecting blood cells productions. Diagnosis typically involve blood tests that check for signs of hemolysis and specific marker associated with PNH. The treatment options may include supportive care, medications that reduce hemolysis, and in some cases, bone marrow transplant. Which of these is a true red blood cells aplasia? The answer is C. Red blood cells aplasia is a condition where the bone marrow fails to produce enough red blood cells. This can lead to anemia, causing symptoms like fatigue, weakness, and pale skin. It can be caused by various factors, including autoimmune disorder, certain infections such as exposed to toxin. Treatment usually focuses on addressing the underlying causes and may involve medications or blood transfusions. Diamond-Blackfan anemia. Diamond-Blackfan anemia is a rare inherited blood disorder characterized by a failure of bone marrow to produce sufficient red blood cells, leading to anemia. It typically presents in early childhood and is associated with a range of physical anomalies, including upper limb malformations, and craniofacial abnormality. DBA is caused by mutation in genes involved in ribosome productions affecting red blood cells production. Patients often require treatments with corticosteroids, and some may ultimately need blood transfusions or bone marrow transplant to manage the condition. In short, DBA is a congenital disorder that depresses only red blood cells productions. Fanconi is a congenital disorder of hematologic stem cells that results in aplasia of all cell lines. Bernard-Sollier syndrome is a disorder with giant platelet. Shidia-Kegashi is a qualitative disorder of granulocytes. Serum ferritin is a good indicator of the amount of. The answer is B. Serum ferritin is a protein in the blood that stores iron. It helps your body manage and release iron when needed. Measuring ferritin level can give doctor an idea of how much iron is stored in your body. Low ferritin level can indicate iron's deficiency, while a high level might suggest an excess of iron or other health issues. Serum ferritin is considered to be a good indicator of stored iron in most individuals. Iron status assessment. Ferritin level reflects the amount of iron stored in the body. Low serum ferritin indicate iron deficiency, which can lead to anemia, while a high level may suggest iron overload conditions such as hemochromatosis. 2. Diagnose of anemia. In the context of anemia, ferritin helps differentiate between iron deficiency anemia and anemia of chronic disease. Low ferritin suggests iron deficiency, while normal or high level may indicate the anemia is due to other factors. Monitor conditions. Serum ferritin level are monitored in patients with conditions affecting iron metabolisms, such as chronic kidney disease, inflammatory disorders, or those receiving iron therapy to assess treatment's efficacy and iron level. Ferritin in an acute phase reactant, meaning its level can increase in response to inflammations or infections, sometimes complicating the interpretations of iron stores. Conclusions. Measuring serum ferritin is crucial for evaluating iron levels and diagnose related disorders, making it an important tool in clinical practice. Where's most iron stores found? The answer is C. Hemosiderin is an intracellular, insoluble storage form of iron that accumulates in tissues primarily when there is excess iron in the body. It is derived from the breakdown of ferritin, another iron stored protein. Here are some key points of hemosiderin. Formations. Hemosiderin forms where the capacity of ferritin to store iron is exceeded, further due to conditions like iron overload or repeated blood transfusions. Locations. It is primarily found in macrophage in the liver, spleen, and bone marrow, but can also accumulate it in other tissues. Histological stain. Hemosiderin can be visualized in tissue samples using special stains such as Prussian blue, which turn iron deposit blue. This is useful for diagnosing conditions associated with iron overload. Clinical significance. Excess hemosiderin accumulations can indicate conditions such as hemochromatosis, a genetic disorder causing excess iron absorption, hemosiderin iron overload without tissue damage, and chronic hemolytic anemia, which is iron released from lyzed red blood cells. High level of hemosiderins can also lead to tissue damage and organs dysfunctions, particularly in liver, heart, and pancreas. Diagnosis and monitoring. The presence of hemosiderins in biopsy can help assess the extent of iron overload and guide treatment decisions such as the need for chelation therapy to reduce iron level. That's all I have for today. Did I miss anything? If you have any question, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time change, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!